Hi everyone, I am Dr. Pankaj Singh, Senior Consultant Gastroenterology at Gastropedia Clinic, Noida. Today I'll be discussing about blood in stool, which is a very common clinical problem that we come across in our clinic. So whenever there is presence of blood in stool, the medical terminology for this is hematochezia. But there are different forms in which the blood can be there in stool. Blood can be either bright red blood in stool, which is actually hematochezia. Apart from this, we can have maroon red color of stool, which sometimes denotes bleeding in the right side of the intestine or the larger colon, and sometimes there can be black stool, which is known as melena. Melena means the bleeding has occurred in the upper part of the intestine, maybe stomach or the small intestine. So what are the causes for blood in stool? The most common cause that we come across in bleeding per rectum are piles or hemorrhoids. And apart from these, the other causes can be anal fissure, they can be anorectal cancers, they can be rectal ulcers, they can be polyps, there can be some vascular problems, especially in elderly, like angiodysplasia, diverticulitis, which is outpouching of the intestine. There can be certain bleeding from these diverticulitis also. Inflammatory bowel disease like ulcerative colitis or Crohn's disease can be another important cause for blood in stool. Infective diarrhea per se can have blood in stool. Then ischemic colitis, radiation-induced colitis. These are the common causes where we can have blood in stool. Now coming to the symptom of blood in stool would depend on the cause. Now if someone is having piles or hemorrhoid, he or she will have fresh blood or splashing of blood in the pan, and these are painless. So they have painless bleeding per rectum. Someone with anal fissure will have definite pain or severe pain in the perianal region, and they do have blood in stool. Those with anorectal malignancy will have a stool which is formed, but it is smeared with blood or blood clots. And apart from that, they also have associated complaints like loss of weight, anemia, loss of appetite, abdominal pain. These are the symptoms which can be there in anorectal malignancies. And polyps can have painless bleed again. Angiodysplasia and diverticular bleed are usually seen in elderly, and they can be presenting with mild bleed to very severe bleed, sometimes requiring hospitalization and endoscopic interventions. Inflammatory bowel disease, if you say about ulcerative colitis, they do have bloody diarrhea and can also have associated features like fever, tachycardia, abdominal pain. And Crohn's disease also sometimes can have blood in stool. And infective diarrhea will have severe episodes of stools like 4 to 5 times or maybe even more episodes of stool with blood. Now coming to the diagnosis of these blood in stool, the basic thing is that first is the history taking. History has to be very clear cut. We need to understand whether the patient is having blood in stool, what is the type of the blood he or she is having, what is the color of the blood, and then coming to the examination. Clinical examination is paramount. We need to have a detailed abdominal examination, rectal examination, and after this we move to endoscopic evaluation. And sometimes surgeons also do proctoscopic evaluation to look at the causes like an anal fissure or hemorrhoids. And then we do endoscopy, like endoscopy in the form of hemodoscopy, in which we see a part of the intestine, not the whole of the colon. And when we have certain doubts that the lesion or the source of bleeding can be higher up, we also do colonoscopy to look at the cause for the bleed higher up in the intestine. Then there are other tests like small bowel evaluation like capsule endoscopy, enteroscopy, to look into the smaller intestine where we suspect the cause of bleeding from the small intestine. We also do sometimes upper GI endoscopy to look at the gastric causes for the bleed. Now the treatment will certainly depend on what is the type, what is the reason for the bleed, what is the cause for the bleed. Suppose if someone is having hemorrhoids or piles related bleeding, mostly more than 50% patients, they do respond to symptomatic treatment, and we categorize hemorrhoidal bleed as grade 1 to 3, 4. Those with lower grade like grade 1 and 2, they can be treated conservatively with some ointment, sitz bath and analgesics and preventing constipation. Higher grade, they do sometimes need endoscopic therapy in the form of injection therapy or may need surgery. Those with anorectal malignancy need to be figured out what is the stage of the malignancy the person is having. They need biopsy for the diagnosis of the cause, and then sometimes surgery is curative. And those who cannot undergo surgery can also be subjected to chemotherapy. Other conditions like angiodysplasia and diverticular disease can be managed most of the time with the help of endoscopic therapy. Sometimes when the bleeding is severe, they might even need surgical intervention. Inflammatory bowel disease like ulcerative colitis may need diagnostic confirmation with the help of biopsy, and they need long-term medical therapy in the form of mesalamine therapy or immunosuppression or biologics as and when required. Infected diarrheas are treated with antibiotics and other supportive treatment like ORS and prevention of dehydration. So these are the common causes for blood in stool we should be aware of, and also how to diagnose them and what are the basic treatment modalities in principle in diagnosis and treatment of blood in stool. Thank you.